to chime in on those?
Yeah, so identifying the root cause again is going into why is it that this occurred. So it's kind of the functionality of, you know, what's occurring to you in specific. So if it's issues with inflammation, then we need to kind of look, do you have a dysbiosis, which means that there's an imbalance, whether it's in your, you know, intestine, you know, good bacteria versus bad bacteria. What exactly has happened to you that has, you know, caused you to have a huge amount of inflammation in your body? Are you producing more estrogen? Is that why, you know, you went ahead and, you know, developed breast cancer for those who are, you know, estrogen receptor positive? Prevention is key in functional medicine because that's what we're trying to do. We're trying to prevent recurrence, we're trying to prevent metastasis, and we're trying to prevent anything else from getting worse. We're actually trying to reverse disease. So science-based, everything is based off of evidence-based medicine. So we look for, you know, the top studies that kind of can correlate with the work that we do and try to get you the best information. Microbiome has kind of been one of these big ones that's been out for debate for a while. I have a great friend of mine who works at the University of Miami for gastroenterology. And when I did the microbiome, as far as finding out, you know, do I have a healthy pathology in my intestine or an unhealthy one? And she said, oh, you know, there's not enough research in microbiome. You know, you have to give us a few years to kind of get detailed. But what happens to the person who doesn't have a few years?
Exactly.
You know? So there are certain things that you need to know now that you don't have certain healthy bacteria in your system and things like that. So that I thought was very helpful. But that's another example of science-based stuff that, you know, is out there. Patient-centered is going back to what does that person do for a living? Do they do exercise? Do you sleep? Do you drink? So all those things, we need to know everything about you. And our questionnaires are super lengthy, and people complain sometimes. But we need to learn about you.
Of course.
And then the interconnectedness is knowing that, excuse me, everything is connected.
Absolutely.
So if, you know, you don't sleep, if you don't get enough exercise, if you don't do something to meditate and take away stress, you're going to end up ill at some point.